Welcome to CHPN Part 2 Pain and Symptom Management. Pain control is one of the most important topics in hospice and palliative nursing, and it is heavily tested on the CHPN exam. In this section, we will review the total pain concept, types of pain, opioid management, dyspnea treatment, and common exam traps related to pain management. Let's begin with the foundation: total pain. The concept of total pain is central to hospice care. Pain is not only physical. It also includes emotional suffering, social concerns, and spiritual distress. For example, a patient may report worsening pain because of anxiety, family conflict, or fear of death. As hospice nurses, we must assess and treat all dimensions of pain, not just physical symptoms. This holistic approach improves quality of life and reflects true hospice philosophy. There are several major types of pain tested on the CHPN exam. Nociceptive pain comes from tissue injury and includes somatic and visceral pain. Neuropathic pain results from nerve damage and feels very different. Breakthrough pain is sudden pain that occurs despite scheduled pain medication. Recognizing the type of pain helps determine the best treatment plan. Somatic pain usually comes from bones, joints, muscles, or soft tissue. Patients often describe it as aching, throbbing, or sharp, and it is usually easy to localize. Visceral pain comes from internal organs like the liver, bowel, or bladder. It is often deep, pressure-like, cramping, and harder to pinpoint. This distinction is frequently tested in exam questions. Neuropathic pain is caused by nerve injury or nerve dysfunction. Patients often describe it as burning, tingling, stabbing, or electric shock-like pain. Common examples include diabetic neuropathy, postherpetic neuralgia, and tumor compression of nerves. This type of pain often responds poorly to opioids alone and may require medications like gabapentin, pregabalin, or certain antidepressants. Breakthrough pain is sudden, intense pain that occurs even when the patient is already receiving scheduled pain medication. It is often brief but severe. The correct treatment is a PRN fast-acting opioid, such as immediate-release morphine. This is a very common CHPN exam question. Remember, scheduled medication controls baseline pain, while PRN medication treats breakthrough pain. These are the most common opioids used in hospice care. Morphine is the gold standard and is used for both pain and dyspnea. Fentanyl is often used in patches or continuous infusions. Hydromorphone is stronger than morphine and useful when patients cannot tolerate morphine. Methadone requires special expertise because of its long half-life and complex dosing. You should be familiar with all of these for the CHPN exam. Morphine is the first-line medication for dyspnea in hospice patients. It helps reduce the sensation of air hunger and improves comfort. Even when oxygen saturation is normal, patients may still feel severe shortness of breath. Morphine treats the symptom of dyspnea, not the oxygen level. This is a high-yield exam concept. Morphine is used for both pain and shortness of breath. Common expected opioid side effects include constipation, nausea, and sedation. These are normal and should be anticipated. The dangerous side effect is respiratory depression, especially in opioid-naive patients. Hospice nurses must monitor closely when initiating opioids or increasing doses. However, fear of respiratory depression should not prevent proper symptom control. Comfort remains the priority. One of the most important opioid rules is this: constipation must always be prevented. Unlike nausea or sedation, patients do not develop tolerance to constipation. That means bowel regimens should begin as soon as opioid therapy starts. This often includes senna, docusate, polyethylene glycol, or other laxatives. This is a classic CHPN exam trap. Let's review the highest yield exam points. Morphine is the first-line medication for dyspnea relief. Breakthrough pain requires PRN fast-acting opioids. Neuropathic pain usually needs more than opioids alone, think gabapentin or antidepressants. And constipation is expected, preventable, and should always be addressed early. These concepts appear repeatedly on the CHPN exam, so mastering them is essential for success.